1 in 45 children, that is the new number when it comes to our kids and autism here in the U.S. Dr. Jared Scowen's here to help us kind of make sense of all this. Good morning to you, first of all.
Good morning, Carrie.
You know, your reaction when we sent this to you was, holy cow. I mean, I think that's the reaction.
Yeah.
There's that, and then there's a bit of like dismay, like, wow.
It is. You know, the numbers have been growing and growing and growing and growing over the years.
Right.
And
fast, too.
Fast. Yeah. I mean, I remember when I was in med school, it was 1 in 200 kids. And now it's 1 in 45.
It's incredible.
And I'm saddened.
Yeah.
I'm saddened because this is heading in the wrong direction. It's not reversing. And this is what we see in our clinic all the time. And the most important part is that if parents are concerned, they need to get evaluated.
And early.
As early as they can.
So the second they think that there might be something at bay with their child.
Exactly. So if a parent thinks that their child isn't developing language as soon as they should, if they think there's some kind of motor problem, the child is falling down or not moving as they should, if they think there's any sensory problem, the child doesn't like their hair brushed or their nails clipped, go see the person to evaluate. And if the child is younger than 3 years old, they call Birth to 3. That's a state organization that does these evaluations. If the child's older than 3, you can go to the Children's Hospital in Hartford, you can go to Yale, you can go to a developmental pediatrician, you can go to a developmental psychiatrist, get the evaluation.
Back to the numbers for just a moment, because the fact that they've jumped up so incrementally and so quickly. Some are saying that perhaps it's the way researchers doing this latest finding are asking questions.
Right.
Your belief is that is the case and it's actually more accurate?
Well, the survey that was just done was over 30,000 people were interviewed. And they phrased the survey questions differently. I mean, all of these surveys in the past, all the research in the past for how many people, how many kids have autism were these feel is more accurate is looking at the kids who have the symptoms that could then lead to that diagnosis.
In our last 30 seconds, tell us about what you brought in here.
Well, the two important things for parents to remember. Number one, there is hope. I mean, our clinic in our office does some great therapies to help kids recover, okay? So you want to get your occupational therapy, your physical therapy, your ABA. There's a lot of biomedical stuff that we do in our clinic, different vitamins, different diets, gluten-free, dairy-free. There's so many things that you can do on top of just what you get in your school system. So do as much as you can for your child because time is the enemy and time is ticking.
Well, and nothing feels worse than if you're a parent and something is going on with your child and you feel like you can't do anything.
Right.
So parents, if you're hearing this and you think this might be happening in your family, have hope. Thank you so much for coming in. Really appreciate it.
Great to be here.